Well, thank you. Thanks for being here this afternoon. I wanted to take today to introduce a new valued member of our leadership team here at the City of Sioux Falls, Dr. Charles Chima, as our next Public Health Director, pending the advice and consent of our City Council at our meeting tomorrow night. Dr. Chima brings a very, very strong background in clinical and population health to Sioux Falls. Most recently, Dr. Chima was the Program Director, Assistant Professor for Population Health at the University of Mississippi Medical Center in Jackson, Mississippi, where they get very little snow. Is that right? His education includes a Bachelor of Medicine and Bachelor of Surgery from the University of Nigeria, a Master of Science in Epidemiology from the University of London, and a Doctorate of Public Health, Health Services Organization from the University of Texas Health Science Center. He has great experience that he's bringing to our city. He's supervised teams. He's worked with a lot of different clinical groups, both abroad and most recently in Jackson. He currently serves as the chair of the Diabetes Coalition in Mississippi. He's led a clinical team in the past in a clinical setting, including leading physicians. And he's also been an executive director for a nonprofit, led a team of 10 officers and 100+ volunteers to promote healthy living and to provide free medical care to medically underserved communities while in Nigeria. And so his background is quite extensive and is going to be very, very beneficial to not only to the population we serve at Falls Community Health, but to elevating the population health discussion in our city and our community. And one of the things that I really appreciated when I was interviewing with Charles was he was really interested in our Parks Department and our Planning Department and housing, and asking a lot of questions that a lot of times many people in the public don't connect to health. But as our health team knows, a lot of our health leadership that's here, those social determinants of health, if you don't have good housing and don't have good access to food and don't have good transportation, those things all affect your physical, emotional, and mental health. And so Dr. Chima's in Sioux Falls this week, doing some meetings that he has to do to get spun up for when he starts, trying to find a house, trying to find a school, trying to do all that stuff. I told him this morning we were meeting the three most stressful things in life are starting a new job, buying a house, and having a baby. And I know you're having two of those, you know, and he said, not on the third, we're okay right now. So he's got a lot going on. So what we wanted to do today was just let Dr. Chima make a few remarks and then open it up for any questions. So Charles, I'll let you have the podium, sir.
My pleasure, sir.
You bet, man.
Thank you. It's really my pleasure to be with you this afternoon, and even more pleased to have this opportunity to be your next public health director. Really grateful for the opportunity. And so this afternoon, I would like to start by just sharing a little bit about my background and kind of my journey, and then from there segue a little bit into public health in Sioux Falls, and say a few words about my vision for the future. So I'd like to a little bit about my upbringing. Was really privileged to have been raised by entrepreneurial parents whose just sheer hard work lifted them and us out of poverty into the middle class. And so growing up, spending the later part of my childhood in the middle class kind of came with a different set of challenges than living in poverty, which is you're in a society where majority of the people are below the poverty level, and then suddenly you are in this middle class status, right? New house, kind of different social network, but then you have a lot of dependents, right? A lot of people that just you're better off than. And you don't have as much public resources to provide for needs. So I grew up with kind of a bit of a unique challenge where we had to learn earlier on the importance of just serving others. So I remember, for example, how as a child we would ask something of my dad, God bless his soul. He would just deny you, say, no, I'm not buying that. And then 1 week later, 2 weeks later, a distant relative shows up in the house, maybe has a sick child or has a child that is out of school that needs to pay tuition to go back to school, and he will cut him a check. And he'll be like, but you just told us you didn't have money to do this, right? So, as a child, we feel like, oh, maybe he loves those people more than he loves us. But then later on, you kind of appreciate why he was doing that. It wasn't that he wasn't the wealthiest, but he really wanted us to learn that you have to take care of others, you have to reach out to others that you're better than. So I kind of learned earlier on the patterns of service, and also being raised in the Christian faith, just the value and the obligation to serve. And that's kind of part of what formed my foundations as to my values and philosophy, and then ultimately the decision to seek a career in public health. So once I figured out what public health I was gonna do, kind of went for it. So started my education, like the mayor said, started as a physician, trained, went to medical school, did clinical practice in primary care, and then really started the earliest opportunity I could find to, seek public health training. So went to one of the foremost institutions of public health in the world, London School of Hygiene, which I think is probably the oldest school of public health in the world, and got a master's in epidemiology, and really want to take that a little bit further to build on my competence and expertise in public health. So got the opportunity to go to the University of Texas Health Science Center in Houston, which is one of the biggest in terms of student enrollment, one of the largest schools of public health in the U.S. And had a doctorate, doctoral training in public health with a focus specifically on leading health service organizations. And from there, then so even prior to that education, I've had a lot of opportunity, like the mayor said, doing frontline work, so leading a really community-based clinic, manage a clinical team, done a lot of work with nonprofits, and so talk about what I bring to the position is really, besides a servant's heart. I think for me that's one of the most important things that it may not be on the job description, but it's really just having that love for people and that willingness to serve, but as well as the expertise, bringing the public health expertise, just like with the training and experience that I've had, kind of have a unique perspective regards to understand both the clinical side of things and understand the community aspect of things. And in my head, it's seamless, but I know there tend to be silos in the real world as to how people see things. But when you have that unique privilege of having been on both sides and having had work experiences that match up with those, then you kind of come with a bit of a perspective. And also the other perspective that I think is unique that I bring is also there's something that you cannot purchase anywhere, which is the experience of having lived and trained in 3 different continents. You just have a different worldview as to, you see some things that people think is a big deal. You've seen worse, and and you just have a different way of approaching things, and just based on different interactions. And so I think that those are really important things, especially thinking about the challenge. So let's talk a little bit about public health in Sioux Falls, and where I think we can build on the great work that has been done so far. Is first, we know obviously the still important topic today is COVID-19, right? And I think the city has really been a great example of how you can work with the private sector to get things done without getting into unnecessary political debates, right, on both ends of the spectrum, but really focus on solutions that work for the community and that gets us ahead. So I think the city has done a great job with its COVID response, and we can build on that. So looking at the recent numbers, see that about 2 in 4, 2 in 5 people in the population, about 41% have gotten fully vaccinated, which is great, but we know we're getting to that point where the uptake is beginning to slow down. So this is where the real work now, the difficult work begins to kind of, figure out strategies for door-to-door community, outreach to really see that we sustain that momentum, so that we get to a level where COVID becomes a thing of the past. We don't want to hear about another wave or surge or whatever terminology, the experts like to call it. We want to get into the fall, feeling confident that a good part of the population has been vaccinated and that we're not going to see any spikes anymore. So that's obviously going to be the first priority, is to see what we can do to engage, especially the hard to reach, but also, they may not be hard to reach, but they may be too busy, right? So that people that still have interest, but maybe they're just too busy at work. And we have to figure out ways to get the vaccine to people and, and make it much easier for them besides having availability in the appointments. So that's going to be a priority. But once we get out of pandemic mode, get out of the public health emergency, then we come back to the status quo. The status quo was one that had its own challenges to start with. So even before the pandemic that everyone knows about now, we had a lot of silent epidemics going on, right? to talk about, I've spent quite some time with this document, the Community Health Needs Assessment that was recently done, 2019, with the Health Department, the two major partners in the city, Avera Health and Sanford, done a great job putting a lot of work into trying to understand the health status in Sioux Falls. And part of obviously, there'll be a long list of health challenges the community is dealing with, but some of the ones that rises are both in terms of the burden as well as in terms of concerns for the stakeholders, both around access to care, around chronic disease prevention, and around substance use and behavioral health, right? And particularly around chronic disease, that's something that every city, every locality, every state in the U.S. has been struggling with. Obesity, for example, it's getting worse everywhere in the states. So Sioux Falls is not unique in that, but Sioux Falls can be the light, right? I think one of my colleagues said earlier today, and just it's kind of something that I felt while one of the reasons I took up this position is something that one of my soon-to-be colleagues said, which is Sioux Falls is kind of small enough that you can wrap your arms around it, but it's also big enough that anything you do here could send a great message across the country. People will notice, people will pay attention. So that's a unique opportunity to have to try out a lot of things and to test new models and to really, because I've been in bigger places like Houston, there are millions of people, but things that work for big cities like Houston, like New York or LA, may not necessarily work for small cities because they're dealing with different realities, different budgets, and different situations. But Sioux Falls is in a place where something that works here will work for a lot of other similarly sized cities, which there are much more of them across the country than the big ones. So I think there's a lot of opportunity. We can innovate around chronic disease, which is both where the need is once we get out of the pandemic mode, but also personal passion of mine because I feel that we have a lot of opportunity to, as the mayor said, to take more of a holistic approach, make it easier for people to live right? So make it the default where people could choose the healthy option. So whether it's in terms of to take the stairs rather than the elevator, right? Or whether it's in terms of buying healthy food, or whatever the risk factor is that we're trying to address. But make it easier, make it the default for people to choose the right thing. And then we can get into the more personal interventions to help people to take up the resources that we provide. But there's lots of opportunity and a lot of ideas, look forward to working with the stakeholders to address them. But some of the other challenges that also Sioux Falls is dealing with is around, again, Sioux Falls is not unique in this, substance use and behavioral health. And I'm glad to see that this is not just a document that was produced and put in the file cabinet. There's actually intention, right? Obvious effort to work on the recommendations in this report. For example, later today we'll be cutting the ribbon on the link, which is out of the playbook of this community health needs assessment, is that we need a resource where, again, trying to make it easier for people and trying to reach out, right? So if someone is dealing with a behavioral health, substance use issue, addiction, they don't have to do all the mental work of figuring out where do I go from here. They know there's just one place they can contact, and that will help them figure out, navigate, where do we go, right? So I think that's a great resource that's going to be of great benefit to this community. And I'm really, really glad to see, the city health department working together with the city government and working with the two major healthcare partners in the state. But also, that's kind of the approach that I see us taking moving into the future is partnerships. So that I would like to say a few words about some of the things I consider guiding principles. So one is obviously partnerships. No matter how large, even if the mayor cuts us a large check to the health department to do more things, there's only so much resources that you can have available in the public sector. So you cannot effectively address the challenges we face in society today health-wise just by yourself. There has to be emphasis on partnerships and workplace interventions to just make it easier for people to live right and live in ways that promote good quality of life and longevity of life. And then, but also some other issues around, I think trust is important. So the pandemic, before the pandemic, few people may understand what public health is, but I think COVID has brought up a sort of a heightened awareness about public health. But there's still a lot of challenges we need to solve around trust, right? Getting people to trust messages that they hear, right, so that they don't doubt anything that comes out of whether it's a government office or a community-based organization. So there's a lot of building of trust we need to do on our messaging, our communication, and working with trusted leaders in the community, be it in community-based organizations, faith leaders, to build trust in science, trust in public health, and and it's kind of be at the foundation of what we do. And also, I think there's a lot of opportunity to, again, compassion, right? Again, that's something that for me is a key word. It's just that love for people, and again, for me, it's something I felt interacting. So when I came to interview for this position, something that came across to me was, this works here, and they're just sitting, just doing jobs to get paid. You could actually feel it from the conversations that there was that clear intention, that desire to serve. Whether it's at the health department or in the city government, I could feel it from the people that I spoke with that they love serving people, and that's why they're doing this, and that's something we share in common. So putting compassion at the center of everything that we do, and recognizing that health disparities was the other issues that was highlighted in this report, which is, think about the fact that we know that nationwide, right, that we have quite different differences in longevity of life and quality of life between different populations. But even locally, as small as we are, we still have quite some marked differences in health. If you move from one zip code to the other, you could have as much as 14-year gap in life expectancy, even locally within Sioux Falls. And that's something we have a great opportunity to work on, right? So kind of we're in this together. I know some people say united we stand, right? So there's nothing that we cannot achieve if we work together. So part of my message this afternoon is to reach out to the Sioux Falls community and to say, really, really glad to be here. My family and I also have 2 young kids who are looking forward to joining the school system in the fall. My wife as well, Neka, we're excited about this opportunity and this move to be part of the great things going on in Sioux Falls, and just to be a part of this community, and we couldn't have chosen a better time to join a wonderful community, and be more than happy to take questions from the gentlemen and ladies of the press here present this afternoon. Absolutely.
So
yeah.
With your resume, you could pretty much do anything, anywhere. Why
Yeah.
did you choose to come to Sioux Falls to be public health director?
So that's a really great question, right? And one that, so a few months back, with the pandemic, when the pandemic set, I really so recently I've been doing a bit of work on the academic side of things, helping train the next generation of public health leaders. So for some of my students, for example, are doctors doing their residency in preventive medicine and public health. And part of the things that I felt during the pandemic was just that desire to get back to the front lines and just help rebuild, because I saw a lot of public health departments bleeding talent, in the recent years, and that affected their response to the pandemic. It's just not having the core expertise needed to mobilize resources and to deal with challenges, even with small budgets, to find creative ways to work with partners. So I felt that strong desire to go back to the front lines of public health work. And while Sioux Falls, the simple answer to that is that Sioux Falls loved me first. Then I kind of just responded to that love, in the sense that just the interactions, and I must give credit to, again, starting with the Human Resources Office, with the great work of seeing that their positions are not just advertised locally, of really using social media to get out awareness about positions available in Sioux Falls. So that's kind of, because without that I wouldn't even have known that there was a position open in Sioux Falls. But once I got in contact with the system and applied, it was just a very beautiful experience with the different interactions. It was almost like just a fairy tale, like how smoothly and how the hiring process has gone. And then something else I think is important to mention is coming here in person. Sometime it was in April. It was just a very different experience. It felt like I was, interviewing at the Fortune 500 company. Just the atmosphere around the city office and how the place is run. It's not, it's not what is typical of public agencies. So there was this level of collegiality that I felt, that just, it's almost like it's palpable. And also felt there's just dedication and expertise around the city health department. It felt like this is a place you want to work. And I think that, like I said earlier, Sioux Falls, it's kind of in a unique place where the lessons that we learn here, the demonstrations that we show, that I'm someone that believes in dreaming big. All right, so I think that Sioux Falls really has the capacity to be one of the healthiest, if not the healthiest city in the U.S. And that's something that's a personal goal of mine, is to see that in the next 5 to 10 years, that we do, invest in, in our community. We partner with stakeholders, and we deliberately set a clear agenda to say we want to be the healthiest city in the U.S. And I'm not kidding about that. And I know we can do that. We have the groundwork done already that we can build on to get there.